What are the symptoms? Very, very simple. That is why majority of the times we will be able to detect this cancer in an early stage, provided a woman comes to a doctor with the problems. What is this? Excessive bleeding, vaginal bleeding, or in between two periods there is a bleeding, or postmenopausal bleeding. We say the periods have stopped for a period of more than 1 year, and again there is a small amount of spotting or small amount of bleeding, which is very, very important. We should not miss this because it doesn't happen regularly. Occasionally a woman may feel spotting or bleeding postmenopausally, or in between the periods she may have over and over bleeding. That is an important sign that something is wrong with the inner lining of the uterus, that is the endometrium. The other symptoms are vaginal discharge, white discharge, or mild discomfort in the lower part of the abdomen or in the pelvis, and when it is very advanced they have a severe pain. So the earliest symptom is bleeding, that's all, vaginal bleeding. Now, how to diagnose this? Very simple method. One is a physical examination, and we have to go and take a small biopsy from there. It can be through a endometrial biopsy, we say papilla biopsy, or if that is not possible then hysteroscopic guided biopsy, or if that is not yielding the diagnosis then D&C, dilatation and curettage. And sometimes if at all we are unable to achieve all this, then we go for a hysterectomy and frozen section. And to analyze the extent or depth of tumor invasion, we need a scan. The most simple is transvaginal sonography. The next better one is either CT scan or MRI of the pelvis will show us the local extent of the disease. And if at all we want to know the distant spread or spread to other parts of the body, sometimes CT or sometimes the PET CT will be better off to give all the details.